No more chronic pharyngitis. When it comes to chronic pharyngitis, everyone is familiar with it, but they may not care much about it. Many people feel that the organ, pharynx, does not have as much presence as the heart, liver, brain, kidneys, etc. However, after thinking about the symptoms of dry and itchy throat, inability to cough or swallow, nausea and retching while brushing teeth, these seemingly not serious but very annoying symptoms have troubled many patients. What is chronic pharyngitis? To understand what pharyngitis is, you need to start by understanding the pharynx. The pharynx not only has to withstand the baptism of various secretions and saliva from the upper nasal cavity, but also is attacked by the acid water and sputum coming back from the esophagus and trachea. It can be said to be embattled from all sides. Moreover, as the first barrier of the respiratory tract, there are many lymphoid tissues in this area, which act like guards to resist various pathogens from the outside world. Chronic pharyngitis refers to chronic inflammation of the pharyngeal mucosa and these lymphoid tissues. It is called chronic because it has the characteristics of long duration, recurring symptoms, and difficulty in curing. Who is prone to chronic pharyngitis? Chronic pharyngitis has an occupational tendency. People who use their voices for a long time, such as teachers, singers, or people who are engaged in chemistry, processing and other work that require contact with irritating gases, are the people who are prone to pharyngitis. With the changes in social structure and people's working methods, people who stay up late for a long time, such as IT people, and online live broadcast groups, have also become people troubled by chronic pharyngitis. Long-term eating habits that are high in sugar, too oily, and too spicy, as well as excessive intake of irritating foods such as alcohol, coffee, tea, and various beverages, will also increase the chance of pharyngitis. The pharynx is the first barrier to contact with air. Smoke, fog, haze, etc. in the air can cause inflammation of the pharynx. In addition, as mentioned earlier, the pharynx, as the intersection of four cavities, is often affected by them. Inflammation of the nasal cavity and sinuses, poor oral hygiene, gastroesophageal reflux, asthma and bronchitis, these diseases will not heal for a long time. All will stimulate inflammation in the pharynx. Seeing this, I believe you can probably judge whether you have chronic pharyngitis based on the various discomforts you usually experience in the pharynx, such as foreign body sensation, burning sensation, dryness, itching, slight pain, etc. If these symptoms occur, you need to go to an ear, nose and throat specialist, where the doctor will conduct a professional physical examination and complete relevant examinations to make an accurate judgment. But we need to be vigilant. As mentioned earlier, pharyngitis is often a symptom of disease in the four cavities. Therefore, it is particularly important to discover the hidden culprits in the nasal cavity, oral cavity, digestive tract and respiratory tract through pharyngitis. It is particularly important to note that early-stage throat tumors do not cause specific discomfort and may also present pharyngitis-like symptoms. Chronic pharyngitis is a common disease, which can also be said to be a sub-health state. Chronic inflammation that exists over a long period of time may cause the following problems. 1. Decreased quality of life. After inflammation of the pharynx occurs, the local secretion function is abnormal, causing dry mouth in the morning and affecting the quality of sleep at night. For patients who need to use their voices for a long time, chronic inflammation of the pharynx will often stimulate the vocal organs downward, causing fatigue when speaking, weak pronunciation, and affecting work efficiency. 2. Some chronic pharyngitis causes local tissue thickening. Inflammation in the body requires more lymphatic guards to resist, causing the lymphatic tissue to increase and thicken, affecting the respiratory tract, causing snoring at night, and in severe cases, apnea and nighttime hypoxia.